when we start to think about how to pull together our plan, we are taking into consideration input from local health departments, our surrounding school districts, our trade associations, the State Department of Elementary and Secondary Education, and others, as people have come up with probably 12 or 15 different guidelines around how to think about this reentry plan. You're going to hear tonight some of our thinking preliminarily. I'm here to promise you that whatever our plan in Normandy winds up being, it will be a Normandy specific plan. That we've been in conversations with superintendents from St. Louis City, St. Louis County, Franklin County, and St. Charles County for the last month and a half. And the needs of those students in those communities are all very different. The resources that they have to deploy on behalf of their students, all very different. The school cultures that they have to navigate around are all very different. And so a month and a half ago, I would have told you that we think there'll be one comprehensive plan that every school district will be able to commit to. And I'm willing to say that Parkway is going to have a different plan from Pattonville, and University City will have a different plan from Jennings. And Normandy will have a plan that is rooted and grounded in the most important needs of our students. And so without getting into the details of that plan, Dr. Pusateri will do that. I do want you to know, as members of our school community, whether you're staff members or your parents or students, that our primary concern is, are our students learning? And how do we advance the ball on getting our kids to hope and possibility? I will also tell you that we found very little information to demonstrate that kids grow magnificently when they are at some distance from the teachers who are supposed to serve them. And so as a guiding principle, we're trying to find the best ways to get our kids close to those adults who serve them in the best way. Simultaneously, we're building a remote learning framework that hopefully mitigates that if in the late fall we find that the county executive has closed all the schools once again and we have to return to a remote learning platform. And so we're definitely making decisions around how to keep people distanced as much as possible. We are making decisions around how to get folks in and out of our spaces, to limit the times in which kids have to be together en masse. But for right now, and we don't know what the next 2 months will hold, things could change. But for right now, our hope is in the fall, we will return to school, not as normal. We may never be back to whatever normal was, but we'll return to school chasing academic excellence and instructional support for all of our kids in our district. And so thank you, because your input is going to help us to take the fragments of the plan that we've put together so far, refine it and hone it in such a way that by next month, we'll be able to position it to our school board.
Thank you, Mr. Robinson. We'll go ahead and turn it over to Dr. Pusateri. Again, he's our CFO and Assistant Superintendent for Operations. Dr. Pusateri.
Yeah. Okay. All right. Myself, hold on. Okay. Good evening, everybody. Like Sharifa and Marcus had said, we're holding this meeting to get feedback on the tentative reopening plans for fall 2020. We are planning to be open. We are planning to be open with all students back each day. And with sanitation, protective equipment, new procedures, and distancing steps that are possible in place. Like Marcus said, we're going to be using several inputs to guide our planning, and we're using these. The St. Louis County Department of Health, CDC guidelines, student needs assessments, whether it's a formal needs assessment at each school or informal needs assessments. The question is, what do students need? Other inputs include funding. Everyone should know that we receive about half of our revenue from the state, and the state has essentially run out of funds, dependent on sales tax and dependent on gaming boat revenue and other sources. We received about $1 million less than the state had initially planned for our district in the month of June. So we're working within those parameters. We're looking forward to a recovery, but we haven't seen that happen yet. We're working in collaboration with the Department of Elementary and Secondary Education. We're working with input from families through the parent survey that went out and the family survey as today's input session. So we do encourage you to put comments and questions inside of the chat box. We are planning with other districts. We are staff to give input, and we are working on committees that include staff of multiple aspects as well as partners. Based on this input, these are our priorities. Our first priority is to answer this question. What does in-person learning look like each day for all students? We improve distancing, increase sanitation, provide equipment, change and update procedures as much as possible. That's our number one question. What does that look like? Our second priority, if schools close, for whatever reason, if schools close, how can we make sure our students succeed by remote learning? We want to learn from what happened in March, April, and May when everybody was learning at home, and we're committed to getting better. We want to build and improve student capacity in using devices and online learning tools. We want to build and improve teacher and staff capacity for facilitating learning and teaching remotely. And we want to make sure that everybody has devices and Wi-Fi access at home. That's our second priority. And our third priority is to look at some other models as well. But today we're really focused on sharing with you our first priority, which is everybody back in school and learning. And we'll walk through these approaches from different departments. Like has been said before, remember, these are our current plans and our current considerations. It's subject to change based on the changing environment around us and based on feedback. We welcome your feedback, and we'll have a firmer plan when we meet with you next month. But we did feel it was important to tell you right now where we stand. So let's start with operations in our facilities department. To make sure you're aware of our plans with regard to facilities. First of all, the frequency of cleaning will increase, at least daily in every active spot, and in many cases, much more frequently than daily. The focus of cleaning will be on high-touch spaces, including light switches, railings, bathroom sinks, toilet handles, places like that. You'll see custodians and facility staff in the buildings cleaning those high-touch spaces. The facility staff has updated their cleaning checklists in response to COVID, and the management team and facilities will run periodic inspections. In addition, we have advanced cleaning technology. We use electrostatic sprayers throughout the district. Now, this is better than a fogger. An electrostatic sprayer uses a specialized solution that is combined with air and then is atomized by an electrode inside the sprayer. What happens is that spray has these positively charged particles that are able to aggressively stick to objects. It sticks better than a normal sprayer. And you want that stick because that makes a disinfectant work when it sticks. We were able to purchase those well ahead of some other districts who were actually still waiting on orders of those that they placed back in April. And we have plenty of those, and we'll be using them. We'll also be providing training for all of our custodial staff on the new advanced methods of cleaning, as well as teachers and all other staff. So we know the best ways to, updated ways to wipe down our classrooms and buses and other spaces in between classes. It'll be hands-on training. There'll be some video training over the summer through the Safe Schools plan, and there'll be some in-person coaching as well. Facilities is providing masks and face coverings to all staff and all students. All staff and all students will receive, our plan now is 3 cloth washable face coverings. and we'll have some principals will have additional on hand as needed. We are encouraging families to provide masks as well when possible, and we'll be sharing resources on ways to use items around the house, in some cases that work as masks as well. We're also asking families to help encourage children to wear their masks onto the bus in the morning or as they come into school. We need to partner with you to help encourage safety in the schools. There may be some plans that vary by grade levels with regard to masks, and I believe we're looking at that, and we're recognizing it may be a little more of a different approach with preschoolers than it is with high schoolers. We're also looking at plastic face shields for staff and students. Those may be more effective possibly in a younger child's setting, and so we're evaluating those as well. And we have begun procurement and purchase of those. We'll have hand sanitizing stations throughout every building as well. So these are some aspects of the facilities plan that we have. Transportation. So buses, I want to be clear from the beginning that we know that we will not be able to follow CDC guidelines for buses. CDC guidelines for buses recommend 12 students per bus. And we would have to start our routes before 3 a.m. if we were to get 12 students on a bus. Or we could buy 3 times the number of buses we have and hire that many more drivers. I do want to share a side note there that we are still hiring for drivers. We right now have 13 open positions. We do have a signing bonus of $1,000 for anybody who joins with a commercial driver's license and then stays with us for a set amount of time. We also hire bus driver trainees who serve as bus monitors, and then we pay for them to train to become certified as a bus driver. So we pay for that training, and all these positions are insured. There's a $500 referral bonus for any Normandy staff member who refers someone who becomes a bus driver. So reach out to me about that, and I can share more. In short, we need bus drivers just for our current routes, and we're not in a position to be able to triple the number that we have. However, we will be making several changes to increase distancing and to protect students and staff against the chance of COVID infection on the bus. So what are we doing? Number one, we're going to have 50% less dense buses. We're going to move from a 2-tier system next year, from the last couple of years, back to a 3-tier system that Normandy had used for a number of years back in 2016, 17, and in prior years. So instead of about 18 or 19 buses spread out over 2 tiers for all of our schools, they'll be spread out over 3 different tiers. That means there'll be about a 50% reduction on the number of students per bus. We'll be sharing more information on this in a memo to the community very soon, once the 3-tier times are finalized and once the schools on each tier are finalized. Approximately, the first tier is going to start about 7:20. The bell will start about 7:20. Second tier will start around 8:10, and the third tier will start around 9 o'clock. Again, that information is coming soon. Another thing we're going to change is we're going to ask children who share a household or who are direct family members to sit 3 to a seat. It may not be comfortable, as comfortable as 2 to a seat, but we think that that's the best way to minimize the chances of students sitting next to somebody outside of their family or outside of their household. And that is within the regulations to have 3 children to a seat. And it's for the greater safety of the other students. We are going to require masks on the buses for students and staff. We'll need parents' help with that. Students should wear their masks to school. And the driver will have a limited number of disposable masks to give away if needed. But again, we want the students to wear the masks from home. We're also going to have a tighter response to disruption or hurtful student behavior on the bus. So at times, if a child is playing or something comes up on the bus, it's much more serious now if there's some play that could lead to exposure of another child to coronavirus. So we'll be taking an approach where there will be less tolerance and for events that could harm another child through possible exposure. In some cases, that may mean bus suspensions occur faster than they have in the past. You should know that each day, each route, the driver will be trained by the facility staff to use proper chemicals to wipe down the entire bus after each drop-off before he or she moves on to their next bus. Then again, another staff member will use different equipment after the 3 morning routes are finished to disinfect the bus and sanitize it. And this will happen twice additional per day. There'll be hand sanitizer on the buses as the students board and exit the buses. We'll be looking at assigned seats to minimize passing. That means the first students go to the back of the bus, and then on the way home, we're looking at a couple approaches where the last stop students are in the back or the first to board go to the back, but we want to minimize that passing time on the bus. I'll tell you, we looked at a few options for transportation that we are not choosing to follow, but your feedback is welcome. Some districts are asking families to register to ride the bus. We just at this point have decided not to do that. We figure that there may be some families who miss the memo and are just left without transportation. So we're at this point choosing not to do that. Other districts are expanding their walk zone. So we have a walk zone where if you live within 1 mile and you need to walk and you're not eligible for the bus, the law doesn't require us to bus students closer than 3 miles, but certainly we do. We considered expanding the walk down to about 1.5 miles, and we don't believe that that's going to be best for kids either. It would lead to less dense buses, but we decided not to do that. Now, with that said, families know that we will have these less dense buses. You know that we'll sanitize the buses. We'll take multiple measures to make sure there's better safety on the buses. Families may choose not to have their children ride the bus, and they may consider alternate transportation if possible. And in some ways, if it is possible, we encourage a family to consider that. Food service. We will continue our breakfast in the classroom where we feel that there's less chance of spread as students are sitting in their classroom facing one direction rather than congregating in the cafeteria. That will continue. When students are in the cafeteria, or if they're in the cafeteria, there will be distancing. We're looking at distancing stickers. Staff will have masks, and we're looking at barriers to put up as well. We won't be continuing with any type of salad bar or dessert bar or anything where a student goes up and kind of serves his or her own food. The food service team is looking at meals and special warming equipment that would allow hot meals to be delivered to a classroom. And we're assessing the cost of those, some new equipment that would allow that to happen. At this time, we haven't yet identified the plan for lunch, whether it's in the classroom, whether it's in the cafeteria, whether it's a mix of some students in the classroom, some in the cafeteria, or some other ideas have been brainstormed, including outside during some portion of the school year when weather permitting. Another operations department that we wanted to share our plans with, it has to do with security. We recognize that we can still make sure students are ready to respond to an emergency, whether it's a fire drill or an intruder drill or an earthquake drill, but we're rethinking the ways we do that. We want to be mindful of drills that could put students in really close contact with each other, and we're thinking about other ways to have those drills occur. For one, the drills generally won't be any surprise drills to start. They'll be clearly announced in advance so we can proceed in an orderly manner and try to keep distancing going. And in some cases, we will not quite simulate the drill, but we'll have a good amount of staff instruction verbally instructing students on what to do in advance using photographs or diagrams so students kind of know where to go. We're changing our practice on visitors. Visitors will be invited by appointment only, and visitors will need to wear masks. We are looking at a temperature check for all visitors as they come in. We believe that's feasible. And then we're going to have a clear procedure where the visitor wears a name tag and is escorted to and from his or her place where they're going. But we do expect to see a lot fewer folks coming in. Even for vendors who are delivering food or materials, we're looking at the same processes for them. Normandy High School, the entry procedures there. We're going to continue with a single point of entry that we did last year. And we're mindful of the sense of safety that we want all of our students to have.
What's making me up?
We want all of our students to have, and we want all of our staff to have as well. There will be one metal detector or possibly two at the entry to the Normandy High School. And there could be some wanding at that single point of entry, much like the wanding that occurred last year towards the end. Next year, there will be clear backpacks at the high school. This will expedite entry, and we won't have as much of a need for the wanding. All Normandy High School students will receive one clear backpack, and that'll be paid for by the district. And then if an additional backpack is needed, we'll ask families to cover that cost. Those are some of the big items for security that we're doing to prepare. Now, outside of operations, there's a health and wellness committee on the reopening task force, and Dr. Cheryl Harris wasn't able to join us tonight. She's leading that committee, the coordinator of special programs for the district. Dr. Harris and her subcommittee are working on a number of items, including what do temperature checks look like for students as students enter? And Dr. Harris is leading an evaluation of different technology that can take temperature through temperature sensors at the entry of every school building. And then nurses would then, if there's any child or staff whose temperature is above a certain level, they would then be followed up with a nurse to see if it was an error or if indeed the person has a high temperature. Dr. Harris is planning what it would look like if a child has some symptoms that are similar to those symptoms for folks with the COVID virus, and where those students would be situated in the building. Dr. Harris and her team are sharing with principals in this task force the steps for students who are sick at home. How many days will a student be away if he or she has a fever? What if he or she has other symptoms as well? What might that look like? So those are some of the things that she is working on, as well as really making hand washing, mask, social distancing, and safety related to the virus a part of teaching and learning for all students, and what those lessons would look like. Dr. Harris will be working on resources for parents to support COVID prevention, whether it's encouraging families to keep children who are sick at home, to promote teaching hand washing to preschoolers, to what does a home temperature check look like, and as well as mask wearing guidance. Dr. Harris and her team will be looking at the expanded roles of nurses. Nurses will be doing more and different than they have before. And then we're also planning for, those days, what if a nurse is absent? What's our plan then as well? Dr. Harris and her team are working closely with Affinia, our partner, the health organization that's based at Normandy High School, that has a location at Normandy High School. And our approach and our steps we're taking is being filtered through Affinia, and we're getting feedback on kind of the medical soundness of the steps that we're taking. Dr. Harris is our first point of contact with St. Louis County and the St. Louis County Department of Health and Department of Public Health as well, which is a key partner, especially in prevention, but then especially in next steps if a case were to surface in our community. Again, we wanted to give you a summary of where we are with our planning. Dr. Harris's health subcommittee is working closely with the instructionals committee, and we're also working with all the committees are working together on the weekly task force about what it's going to look like with on-campus learning. Just like the buses are not going to be strictly following the CDC guidelines of 12 students to a bus, the 6 feet distance that is recommended through CDC guidelines between students is not going to be possible in many, many cases, most cases in the school setting as well. However, there are several steps that we will be taking to ensure the safety of the children in Normandy schools. And with that, Dr. Ryder is leading the academics, the teaching and learning plan. And Dr. Ryder will take over from here to describe the update from her committee.
Thank you, Dr. Pusateri. You can remain the host of the slides. You don't need to turn that over to me because I just have this one. Thanks everyone for joining the call, and I anticipate many, hopefully, questions to push our thinking and some good thinking and input from everyone on the call to help guide our committee. So as Dr. Pusateri shared earlier, we've had a larger task force working on the return to school. And then as part of that task force, we have several smaller committees with relatively large groups of people working to fulfill those areas. So for academics, I have principals and teachers and other instructional people and support people all working with myself to come up with a plan for academics and the in the classroom learning. So as Dr. Pusateri mentioned earlier in regards to transportation, similarly, as he just also mentioned, we will not be able to follow the CDC social distancing guidelines in the classroom to the fullest extent. However, we do have several precautions that we are taking, and I wanted to share a few of those with you. We are planning to distance as much as possible. Our team analyzed every classroom space in the entire district, and we kind of have a sense of how many students could fit in a classroom based on, for example, 6 feet of social distancing, and then therefore if 10 kids could fit in a space, we know with even 3 feet of social distancing, we could fit approximately 20 children in a space. So we're taking all of that information into consideration so that we can build classroom sizes to have as much distancing as possible without being able to follow the guidelines to a T. We also know that when we go to a grocery store or Walmart or wherever we go, sometimes we walk down the wrong aisle, or sometimes we get too close to someone else. So we know that as human beings, that's going to happen from time to time. But our job really is to teach students how to avoid that from happening and also put that space in as much as possible. So in shared areas and in hallways, cafeterias, gyms, recess, and other larger areas, we will be able to put the 6 feet of distancing in place. And we will do that in all of those spaces that we absolutely can make that happen. Secondly, principals and school teams are looking this week at arrival and dismissal procedures. So maybe kids coming in one way and going out another way, so kids aren't crossing paths. Also walking through the hallways, we've done a lot of brainstorming. For example, should we put tape in the middle of the hall to make sure that we stay on our own sides of the hall? Do we need, I'm sure you guys have seen at even like Ross, they have X's outside and you gotta wait, to be able to go into the store or whatever. What kinds of precautions like that do we need to put in place for our children as reminders of that distancing? And we're also looking at signage and some other things to help with that. We also recognize that this is something kids obviously have been exposed to because we've all been living with this for a few months, but they're going to be in a different environment. So we may need to explicitly teach our children what it really means to social distance and why we have to do that, and what the health benefits can be of that. And so it's a learning opportunity as well. We also have thought about water fountains and what do we do about that? Because if everyone's touching the same button to get a drink of water, obviously we have more exposure and can't necessarily sanitize between every single child. And so we're considering and looking into purchasing water bottles so every student has their own and will continually have their own, so we don't really even need to use the water fountains. And so that's one of the things that we're working on now. Third, we are brainstorming and planning for individual supplies where possible. So you've all been in classrooms before. either as a student or as an adult. And we know that when we have a math lesson going, sometimes we're sharing manipulatives between small groups of kids. In art classroom, we might be using the same art brushes to paint from class to class to class. So we have to think about all of those minute details, library books, and checking them out, and how we're going to sanitize between that, or if we can get individual supplies for everyone. Well, obviously we can't provide a whole library to everybody. So we'll have to do some creative sanitizing there. However, with math manipulatives, it might be a possibility that we can give little baggies of the same materials to each child instead of them all being in a bucket, and we just pass out a handful or whatever to each child. So we're really working through some of those details. In addition, we want our kids to continue to have a rich educational experience at school. And so we want to make sure that our kids are exposed to elective classes, have an opportunity for outdoor learning when appropriate, and to have recess continue. We all know our kids enjoy having recess every day. And so we want to make sure that we can continue with those practices and have that be as normal as possible, with putting some precautions in place and ensuring distancing, again, as much as possible. Another piece that has come up in our conversation is that when students sing, it's actually recommended to have even more distance between child to child, because when they're singing, there's more possibility for droplets to occur and be passed along to someone else. And so we're even looking at sort of some outdoor areas for our choirs to be able to meet. Now, obviously, we're going to have a challenge with that when it gets a little bit cooler. But in the beginning, we might be able to do some of those things. And at the high school, especially, and the chorus there, we're looking at some creative sort of outdoor ideas. The other piece is, with some of our classes, typically students leave and travel from classroom to elective class to elective class. We will likely have our students travel to PE because we want them in that larger space, and we want kids to have that movement and that opportunity to move around the school a little bit too. But in many cases, we will also ask for our adults to travel instead of the children to travel. So at 6th, 7th, and 8th grade, where kids typically would switch classes between science, social studies, ELA, and math, we will likely have the teachers rotate from classroom to classroom instead of the children. And that is just less exposure. Kids are at their own desk in their own spot most of the day. There's positive and negative to that, because then we don't have the movement that kids are used to, and we'll need to pack in more breaks and things like that. But it's less exposure and safer in the end for our students. And last but not least, we are working on continuing to build up and improve our remote learning plan. All of you were involved in the transition when things happened so quickly in March, and we rolled out a plan, got kids online, got devices in kids' hands as best as we could, and kind of rolled with it. We can't do that from here on out. We must have a solid plan that is congruent and seamless from what our plan is in the classroom. And so we're working on building that piece out as well, so that if and when we have a school closure or a classroom closure for a child getting sick or a teacher getting sick or something to that effect, that we can still have learning happen with our students, and we're not doing something completely different than what kids are experiencing on a daily basis. So that's where we are so far with academics.
Okay, thank you, Dr. Ryder. At this point, just some final notes. Like I mentioned before, we will have this Q&A. Any questions that are posted, and I have a few that have come through. Any questions that have been posted this evening, in addition to the questions that were submitted prior to the meeting, we will compile those along with the answers and post those on the website. Our next meeting is for July. We will announce the date as soon as we set it, which will probably be within the next week or so. And we plan to start communicating any updates once we start solidifying the plan. We do plan to start communicating probably on a weekly basis, updates as to where we are with the planning process. Between now and the next meeting, if you have questions or comments, you can always submit them. We have an email address set up, info@normandysc.org. We also have a phone line that you can use. It's 314-493-0141. You can leave a message, or you can also text your questions or comments on that line. I'll go ahead, Dr. Pusateri, Dr. Ryder, Mr. Robinson. I'll go ahead and start asking some of the questions that I've received so far. One question, will there be any learning plans made for those who are high risk?
Yes, we are exploring that. And again, we are, one of the things we talked about in our last committee meeting was literally an option of a camera and microphone in a classroom where students who can't be in the classroom for whatever reason are actually on the display board in the classroom and involved in the classroom learning, just like a student, as if you would be in the classroom. So that is our hope and dream. And we're working to try to get that in place. So that's where we are with that at this point.
We had a couple of questions about social distancing in classrooms. The first question is, define social distancing when it comes to children in a school setting, and it's a follow-up question. Will there be social distancing in classrooms, and is anything under 6 feet not social distancing?
I mean, I think that's a really good question. And unfortunately, there's not a really great answer to that. The CDC came out with guidelines that proposed 6 feet of distance in classrooms. We don't currently have the square footage to do that in Normandy Schools Collaborative. There's discussion in St. Louis City around 3 feet of distance between students as appropriate social distancing. And so I imagine within the next 3 weeks, we're going to hear from 4 or 5 different sources, 4 or 5 different responses to that. Our goal is, as much as possible, not to stack our kids into classrooms. And so it's really hard to contemplate this in an era of declining revenues from the state. But we're going to try to hold class sizes to a relatively moderate level. So you won't find classes with 30 kids in a room or 26 kids in a room. But we cannot guarantee that in every space we'll be able to maintain a 3 to 6 feet distance between every student.
Related to that, and I think you've kind of alluded to the answer here. How many students will be in a classroom, and what is the maximum student-teacher ratio?
Yeah, I mean, we're working through that every day. Dr. Pusateri and I were just talking about student-to-teacher ratios not 2 hours ago. And so we are working through what those numbers look like. And in all honesty, to maintain some of that, we may have to shift some students between buildings in an effort to get to the best maximization of our space so that we don't have overcrowding. So know that our first priority is to keep our kids safe. Our second priority is to make sure that they're well educated. And while it is incredibly chaotic and disruptive, we may have to shift some kids around in order to maintain what we think is an acceptable level.
Okay, next question. Will employee sick days be increased?
Right now, we don't have any plan to increase employee sick days. Um, our hope is absolutely to do our level best to keep our employees safe and secure, especially those who are concerned about health and well-being. But at this point, we don't have any plans for additional sick days for employees.
If I can add, at the same time, our Human Resources Department is fully aware of all the federal protections of anyone with a diagnosis that have been legislated. So any employee who does have a diagnosis would work directly with the Human Resources Office to be sure that she or he is taking advantage of all the, is aware of all the possible options available through legislation, which may involve maybe there may be something related to sick time if a diagnosis occurs.
Okay. Our next question is about taking temperatures. Are temperatures being thought of prior to entering schools, like when entering the bus? Any child with a 100.4 temperature could be sent home and name checked off to notify a parent with further steps to take so the bus won't be exposed on the way to school.
We certainly are doing that at the entry to the school building. We get stuck. We consider doing it while students were going to board the bus, but we can't lawfully, as I understand it, leave a child at the bus stop with no parent there. So due to that and due to the reasoning that we needed to keep our buses moving and that we can't leave a child at the bus stop, so even if the child had a temperature, we have to convey him or her to school. Our plan is to have temperature taking at the school site and then to quickly arrange with parents, and it's not always easy, to arrange with parents quick pickups to minimize any exposure at school, to have a clear isolation space and we're considering what different air circulation systems would look like in this other space where we're looking into that. And then we're looking also at if the parent is unavailable, we're looking at what services are out there to convey a child home, whether it's a car service or something similar. So we're definitely thinking through that.
Next question. Will there be a discipline policy for students who do not or will not keep on their mask?
I mean, that's difficult to respond to. At 11th grade, that's a question of defiance. At 3 years old, that's a question of being 3 years old. And so I would say that the consequences should be age-appropriate consequences that take into account the developmental level of the student.
Thank you. Next question. In order to have virtual learning in the classroom, will they update the technology?
Yeah, we are definitely working through trying to put a different kind of backbone in. So we are trying to ensure that every student has access to a Chromebook. And when we say every student, we don't mean just every family. We may have a household that has 3 students in it. We should have 3 Chromebooks in that household if we're in a remote learning situation. We want to make sure that every family has access to a mobile hotspot if necessary to provide access to the internet. We're also trying to find the resources to implement cameras and microphones in our classrooms such that for any number of reasons, if students have to be remote, to Dr. Ryder's point, even if one kid is out, that we have an opportunity to say, while you're in this quarantine situation for 14 days, you have the ability to log on through the internet and actually view the classroom as it's happening. We haven't found the technology that would make that interactive. We're looking, but we haven't found the technology to make it interactive, but hopefully we're able to afford the infrastructure to at least give kids a window to be able to see and hear what's happening in the classroom if they can't be physically present.
Next question. What will the new student attendance policy be? I guess, is there going to be a change in the student attendance policy in regard to COVID-19?
I can share that we're certainly at any attendance incentives, whether it's staff or students or something that we're not going to be proceeding with. Certainly don't want students to be coming to school if they're ill. We take some guidance from the commissioner of the Department of Elementary and Secondary Education, who has said we kind of need to rethink the approach to attendance as well in the light of safety. That's from a big picture perspective, what our thinking is now.
Thank you. Will the Early Learning Center continue to walk students into the classroom?
I don't think we know that one exactly, but we can check with Dr. Hunter. And I'm in touch with Dr. Hunter about the arrival plans, but I'm not exactly sure.
Will there be a modified school schedule as far as the start and stop time?
Well, the three tiers for next year have the first tier starting at about 7:20, the bell time. The second tier starts about 8:10, and the third tier starts about 9 o'clock. And the length of the school day is essentially the same as last year. It might be a couple minutes longer.
How will contract tracing work? What happens when a student, their family members, or a staff member tests positive?
We certainly will partner immediately with St. Louis County and partner with them to follow their lead. We've already recognized that is the process, as they're the authority over that in our community, and we wouldn't hesitate to jump in and share everything that we need to help make that happen. It could lead to closure of one or more schools as a result. So we certainly are aware that we may need to do that.
Someone had a follow-up question to the classroom size discussion. The number 25, they were concerned that that's pretty much the standard number for students in the classroom, and they had questions if that was considered, is that still considered social distancing, or is that safe for our students?
I mean, we're certainly trying to keep our kids as distant as possible. I'll reiterate, we're not in any position to keep our kids at 6 feet in any of our classrooms. Nor are we in a position in the next 2 months to reconfigure the space from a construction standpoint. And so I can't tell you tonight what the magic number is. I will say that one of our considerations in terms of staffing, in terms of student assignment, is class size. And so it's unrealistic to think that we'd be down to 14 students in the room in order to maintain 6 feet. But I don't think it's unrealistic to say 28 kids in the room is too many. And so we're still working through the algorithms around how many kids in a room. We're definitely going to try to skew toward what's reasonable. But at this particular juncture, we can't make any claims that our classrooms will be socially distanced.
We also work within the context of developmentally appropriate class sizes as well. And we also think about, we work through a lens of equity as much as we can as well, so that there's consistency from one second grade class size to another second grade class size to another second grade class size. So there's not a huge difference between the schools.
Okay. Do we have a plan for after school activities yet?
Our focus really has been on the instructional day. And so at this particular point, we haven't taken on after school.
Okay. There's been several reports about the shortage of subs available for school districts throughout the area, and Normandy is no exception. How do we plan to handle that when a lot of times students were divided and sent to other classrooms? How will this be handled if we don't have a sub?
And we actually had a pretty substantive conversation about this last week. And we do use an external vendor to provide substitute teachers to us. We'll probably continue to use that vendor. Additionally, we've contemplated even our own internal sub pool to be able to make sure that we have multiple sources from which we can draw folks. So our sense is we should not be in a position where we'd have to stack twice as many students in the room because we don't have enough adult supervision.
Further, our hope is that one upsides to the economy going the way it is that there may be some additional folks out looking to see what they can do to support a school. And so our hope is that more folks will be applying for bus driver positions, and then there's more subs available as well. So we invite you as community members to encourage folks to see if you know somebody who's looking, we're certainly hiring. Or our sub company is as well, and we're happy to refer you over to them.
Okay. Someone had a suggestion / question. Why limit school to a physical building and not plan to coach parents for help with school at home?
So I think we have had some conversations actually about offering parental support and parental classes to prepare parents in case there is another closure, or in case a parent, for a health reason or something of that nature, has to choose to keep their child home for an extended period of time. And so I would say stay tuned. We're working on that, and definitely agree that having some sessions with parents so that we can all be more supportive of our kids and have, sort of the tools in our toolbox to be able to do that certainly is on our radar.
Okay. What if a parent is really anxious or very uncomfortable about their child or children returning to school? Are there any other options for attending the upcoming school year?
Not currently. I think when we start to think about those type of remote learning opportunities and virtual school opportunities, our first priority is to make sure we have the technological backbone in place to make that work. And so if we need to have a fully formed virtual school, we want to make sure that we not only have the infrastructure, the servers, the computers, the cameras, the software to deploy it. We also want to make sure we have the training to make that go for students, and that teachers are ready from day one to provide a quality experience, although they are remote. And so we're thinking through those realities. And I think if it becomes a situation where a significant number of our students are out, we would likely make a move toward establishing some type of virtual school program. The upside then would be, if I'm uncomfortable sending my kids into a social environment like Jefferson, like Obama, that I would have the option to continue to educate them at home. The complicated thing, Sharifa, is that like any other school, it would have a fully formed curriculum, it would have academic accountability, it would have attendance as well, right? And so as a family, we'd have to, at least on a semester by semester basis, make some determination about whether or not this is something that we could commit to. Because while we were caught by surprise in the spring and accountability was difficult for us, given that the pandemic was new to everybody in the country. By the fall, we would probably be a lot more responsible with that. And consequently, then I think that type of remote learning opportunity will feel very different, right? Like we would say, just like if they were reporting to Lucas Crossing, they'd have to report to this virtual school by a certain time. Just like they'd have to have a certain amount of hours on task at Washington, they'd have to have a certain amount of hours engaged virtually through the computer. And so I think the level of commitment from an adult perspective virtually is a heavy lift. And while I think we're willing to do what we can to support families who have to be remote, I think it's also important for us to lift up that is a labor of love for the family as well.
Thank you, Mr. Robinson. Next question is about accreditation. How will accreditation stats change during this school year? Attendance, especially academic achievement, will Normandy be held to the old standard still?
I can speak to that. So just like the pandemic, when it occurred in March, several decisions were made very quickly by the Department of Elementary and Secondary Education at the state level. So for example, we did not do the state assessment in the spring because there was no way to be able to implement that successfully and in an equitable way across the state, all of our children being in virtual learning. The same is true with attendance. So expectations were different with attendance as well. At this time, I don't believe there has been a ton of, black and white sort of guidance on what that would look like in writing. However, the superintendents are speaking with one another and working in collaboration with the State Department to work through some of those things. So I would say stay tuned. I don't know that we have a definitive answer at this point on how we will be measured coming up in the next school year.
Yeah, right as the pandemic was happening, the state was adopting new accreditation standards. And it's just really unclear about how any of the districts are going to be assessed given those new standards, and whether or not the pandemic causes them to shift any of those standards, MSIP 5 to MSIP 6. And so we have to stay tuned as far as the accreditation is concerned. But when it comes to things like attendance, the state has definitely signaled that they intend to provide some flexibilities, but they haven't said what those are. So as soon as we have that information, we will roll it into our planning.
Those are all of the questions that I think let me go back right quick and see if there's anything that. Okay, here's another question. Why don't parents have a choice in choosing remote learning or in person?
I think that's a great question. And I think in an ideal situation, we'd already have a platform where kids could fluidly move from a virtual situation to an in-person situation. We currently don't have that. And so in terms of order of magnitude, here's what we're working on. First, what does re-entry look like for the lion's share of the kids who are actually returning to school this fall? How we make sure that we keep them safe and give them an environment where they can learn. Secondly, how do we plan for what everyone anticipates will be a resurgence of the virus as flu season sets in October and November? What happens if the county executive says the school buildings must close again? Under those circumstances, then we have to be ready to close school on a Wednesday afternoon and then Thursday morning be up and at them at 8 o'clock in the morning with our students ready to learn virtually and our teachers ready to teach. So then that doesn't mean that we haven't considered the third priority, which is not just what do we do for parents who choose to not send their kids to school on a daily basis, but what about parents who don't have a choice? For serious medical concerns, either that the children have or folks around them have. And so building that infrastructure is also something that we're thinking about. And as planning happens this summer, as we watch the shifting dynamics in COVID-19 cases, we may have to have something ready for the fall, but the dominoes have to fall into place. And so what I want folks to know is it's very much on our radar screen. We're very committed to trying to find those flexibilities, but I just also wanted to articulate how we're prioritizing the planning as we're going along.
Okay. I believe that's all the questions that were submitted. Well, I think if we didn't, oh, wait a minute, we got a new one. Oh, okay. Has it been considered to possibly have a 4-day school week for students to help minimize the exposure among children, at least for the first 2 semesters during the possible surge?
Great question. I mean, we're not quite at a 4-day school week, but we're definitely seriously planning for a 4.5-day school week. So that doesn't exactly get us to the place where folks imagine, but we're definitely contemplating that. Not just from the standpoint of limiting exposure for our students, but also trying to think through the tremendous professional development load that our teachers have. And so when we start talking about continuity of learning and kids learning to read via computer and kids learning to do math via computer, we have to also take into account their teachers have not been trained to teach in this way. And so we're looking at teacher training for the summer. We're also looking at continuity of that teacher training throughout the school year to ensure that should we get to mid to late fall and see a resurgence in this deadly disease, that we have adequately trained our instructors to be almost as engaging remotely as they are in person.
Okay, great question. Did anyone of Dr. Pusateri, Dr. Ryder, did you have any other additional comments that you would like to make?
No, thank you.
No, thanks.
No. Okay. All righty. Like I said, we'll post the video on the website along with the questions and answers that were asked. And like I mentioned, we did have some questions that were submitted prior. Some of them we did address. There's some of the questions we did address prior just because they were duplicated in the meeting. But we'll put together a Q&A based on the questions and the answers that are received. And then we'll also post this video on our website, and we'll send a link to everyone once that is posted. It probably will be maybe next week, maybe after the holiday. But that will be posted, and we'll make sure that you all are aware of it, and we'll post it on our social media as well. So any other parents who didn't get a chance to sit in the meeting. But like I said, if you have questions between then and now, we have our email address, which is info@normandysc.org. We usually get to you at least within 24 to 48 hours. Then we also have our Normandy community line. We can do voicemail and text messaging on that line. That's 314-493-0141. Then we also have a question feature on our website. If you go to the home page and it says ask a question, you can submit your question there. And like I said, we usually get to you within 24 to 48 hours. Just make sure you leave at least an email or a phone number so that we can respond to your question. I do thank you for coming and spending this time with us. I think we got some really good questions, and I hopefully you walk away with some information that we can use moving forward. So thank you very much and enjoy your evening.